And it is the end of the day. And as promised earlier, I had come in live earlier in the morning and I had basically informed everyone. This is Dr. Din, for those of you who do not know me. I am an anti-aging doctor in New York. I have an anti-aging center. Right now I am finishing my anti-aging center and I am here to answer some questions. So basically what we are going to be doing today is answering a couple of questions, and then I have to go over a very important form that I want to I started going over it yesterday, but I want to also go over it today because this is something that allows men to figure out how much erectile dysfunction on the spectrum of erectile dysfunction where they are. So it's really important for guys to start evaluating and assessing themselves early on. Now, this is something that we don't really train our doctors to go and tell their patients early on until they start coming up with these problems. So I think that the best way to take care of problems is to prevent them. So again, some of these things that we do at our anti-aging center are going to be very important for people. So the first question that I have is what is Botox and what is anti-aging medications? So Botox is an anti-aging medication. It basically lasts in your body between 2 to 3 months. It has to be injected. It is a medicine, so it has to be injected under the skin. And as it gets injected under the skin, that's when you basically see the results. The skin totally starts healing itself. You look smoother, you feel smoother. It doesn't last a long time. However, it's a really good medication. If you've not tried it, please do. Usually people want to try it a little later, but it is something that is a really nice medication. It's an anti-aging medication, helps you prevent some wrinkles in your forehead. So as you get older, as you hit your 30s and 40s, you will start noticing that your skin is beginning to crinkle and it is beginning to not appear as fresh as it was 10 years ago or 15 years ago. And what are the steps that you can take that will totally help you bring the clock of your skin back by 5 or 10 years. This is something that is regularly done by all the super famous athletes. This is something that is regularly done by all the big big stars, models. But now a lot of routine people are also catching on. So that's where I come in. This is Dr. Din, and I we train people that these are injectables. You have to come in a certain times every year to do these treatments. So I always post some of these treatments, and so please don't forget to follow me. Do follow, and then we will talk about it. So one medication that we do is, of course, Botox. And then the second medication that we also offer at our place is our fillers. Now, fillers are slightly bit different than Botox. Botox just relaxes the muscle. However, when you try fillers are hyaluronic acid fillers. They are slightly different. So there are certain parts of your face where you don't want to relax the muscle. So the lower part of the mouth. Now this is an area you're talking, eating, smiling, crying, whatever. So you don't want to relax these muscles. So what we do over here is that if you have like loss of collagen. As you get older, we inject medications under the skin in the lower part of your face, and that basically just saves your face from just falling apart in your 40s and in your 50s. So these are minimally invasive. You just have to make sure that you go to an injector or a doctor who is sufficiently trained and has a lot of experience in working with different kinds of faces. So that being said, these are the two most common anti-aging medications that are being used these days. Try them. Definitely worth not only trying them, but also learn about them. The other thing that a lot of people are now going to find out is, as you get older, you don't just put Botox and fillers to help yourself. You also don't just keep getting cut every time, because just surgery will not take you that far. I mean, there's only so much skin that you have, and at some point you can't just keep pulling it. So what are the things that you will be able to do at that point? Those are skin tightening procedures, and that is something that we also recommend in your 50s. So you don't need them in your 20s or 30s unless you have like a lot of weight gain and weight loss. Those people do need it, but other than that, most people will require skin tightening in their mid 40s and 50s and onwards. We also recommend vitamin infusions, which are like basically for skin enhancement and hair enhancement, and really, really good. So that is something also a lot of people do it. So that being said, the other thing that I want to talk about today is not a very important thing as far as a lot of guys are concerned, but again, this is an erectile dysfunction form that we have in our office. So I'll just bring it close. I don't know if you guys can see it. There you go. It shows Juvanni. So this is an IIEF 5 questionnaire. So this is like a lot of urology offices use it. So what we ask over here is that everybody who comes in, where they're doing like different treatments that we do. So usually we recommend 6 treatments. And then what I do for this machine is that like we basically say that during like the 6 treatments, each time they come, they tell us how they feel afterwards. And basically these are a series of like 5 very basic questions. However, you gotta really know yourself, and you really have to know yourself to really understand if you're doing it correctly. So how your pelvic health and pelvic floor is working is directly related with how you fill this form. So this form is very, very important, especially men. They have to not only know these questions. Thank you for joining. Oh, I see people joining. However, just know these questions and please learn them also. So I have posted them on my site. It's on my Instagram. It's also on my Facebook. So if you don't follow me there, please find me over there. Otherwise, I will definitely post a picture of it and a link of it. Again, this form is not that difficult. The question number 1 on the form is, over the past 6 months, how do you rate your confidence that you could get and keep an erection? So there are 5 answers to it: very low, low, moderate, high, and very high. And it's scored appropriate also. So you basically just say wherever you feel. Then the second question is, when you had erections with sexual stimulation, how often were your erections hard enough for penetration? Again, this is almost never or never, a few times, sometimes, most times, almost always. So again, it's graded by number. You figure out your number, and and the reason you want to mark this is because at the end you have to calculate the numbers, and then we figure out if you have a number. If you're under 7, that means that your erectile dysfunction is really, really bad, and we can't help you with just one machine. You'll need to go see a urologist and a lot of other people. However, if your number is like 15 and above, then that means that you have a chance with us. So most people in their 40s, in their 50s, if they've not destroyed their bodies by then, we can help them. So number 3 question on this is, during sexual intercourse, how often are you able to maintain your erection after you have penetrated your partner? And that is something that usually people find a little hard in answering. And question number 4, during sexual intercourse, how difficult was it to maintain your erection to completion of intercourse? So again, for men, this is an important question. And again, it's extremely difficult, very difficult, difficult, slightly difficult, and not difficult at all. So again, we grade you with the numbers. Last but not the least question is, when you attempted sexual intercourse, how often was it satisfactory for you? And again, we have a gradation with that too. And the scores are 1 to 7, 8 to 11 is moderate, 12 to 16 mild. So if you're over 15, like over 12, you're like mild ED. And on that spectrum of mild ED, I have so many patients who fall on that spectrum, and they tell us, and this is in their 70s, they want medications for it, because they're not aware that we have machines now to prevent these problems. And when you are at like the highest level, like 22 and more, I would suggest that you have no ED at that point. And the best way to protect something is to protect it when it ain't broke. And that is something that I tell people, that if it's not broken, do it once a year, and get it in line for yourself, and protect yourself at all costs. Because this is something for women, it's really easy. We take care of our pelvic health. We go for routine pap smears, we go for childbirth, we go for vaccine and everything else. So women are in touch with their innermost selves and most important selves. However, men, on the other hand, have no clue. They've never been there, so they usually show up when there's something wrong. And usually by the time they show up, it's quite wrong. So try to prevent it at Juvanni, because we are not just your skin doctors. We are basically concerned with your complete anti-aging. So we're not just interested in your facial and neck beauty and your weight. We are also interested in your pelvic function and your pelvic health and maintenance of that function, because your pelvic health is going to be the thing that will determine how you face life, how you experience old age. I used to be the director of a medical nursing home and a rehabilitation center just in Scarsdale for like almost 7 years before I decided to do anti-aging. And I very clearly remember that people in their 70s and 80s in America, they age really poorly. Everything is falling apart. Medical science has managed to extend your lifespan, but medical science has just not improved the quality of your life. And that is something that is so really important. So thank you for watching, and I hope to provide you very good information that will allow you to protect yourself, and that will allow you to experience your aging with agency. And that is something that none of our ancestors ever experienced. This is for the first time in human history. This is becoming possible for us to have some agency over how quickly our bodies are going to disintegrate. So to help ourselves, we have to learn these anti-aging medications and these anti-aging machines. And I deal with both. And that is the reason that I'm here to let you guys know we're around. People like me are around, and we assist you in aging really, really well for yourself. And it's not even that expensive. It's not for everyone because it's not covered by insurance, so you have to like really invest in yourself. And a lot of people are not into medications, and these are seriously medications and machines that allow you and help you in living longer. For some reason, I find it paradoxical also, because the thing is that if you do not experience, if you don't want to deal with medications and science, then don't do cardiac catheterization as well. Don't do knee replacement as well. I mean, you do anti-aging for internal organs. If your kidneys goes bad, you go and get a new kidney. But skin, that is your largest organ in the body that allows you to recognize yourself. We don't take care of that. So, but now, guys, there are medications that will help you preserve the architecture of your face for as long as possible without having to get it cut. So isn't it important for us to know how we manage to do it? And it's not even that expensive. It's like maybe the cost of a vacation or something. So if you guys want to learn more about this, please don't forget to follow me. And I will be going live. I usually try to go live twice, once in the morning and once at the end of my day. So follow me. And if you have any questions, please comment over here. This is the place where I come in and I also answer your questions. So some of the questions I already answered for the day. However, if you have any more questions, I would be happy to answer them tomorrow, and I will be around. So again, this is Dr. Din, and I am an anti-aging concierge doctor in New York, and I'm here to advise you and also help you understand how anti-aging works. This is a new age science. A lot of doctors don't know. They're still understanding the importance of it. And this thing is going to really be very, very big within the next 4 or 5 years. It's already taking off. And healthcare, as we have experienced in the last 50 years, is changing. And that change is very well needed also. So take care, guys. Thank you for joining. And don't forget to follow me. Bye. Good night.